All right, everyone, we might get started now because I know that for most of you online, you are probably pretty flat strapped at the moment. So we really appreciate your time today. We will try to keep the webinar today to about half an hour in recognition of your time restraints as well. So thank you everyone for joining us this afternoon. My name's Dee Spink. I'm the Acting Assistant Secretary of Together. On the line, I also have my colleagues, Billy and MJ, assisting with the chat and the Q&A as well. So before we get started, I would of course like to acknowledge the traditional owners of the lands on which we're meeting today, all across Queensland, and pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander members that we might have on the line with us today as well. So once again, thank you everyone for joining us today. We know it is a less than ideal time for us to be having these discussions. I know a number of our members are already on school holidays, and this is, we do want to acknowledge at the outset that for some members, this is a very confronting, issue as well. So we do acknowledge that it's not the best time, nor for a lot of us the best thing that we have to be discussing at the moment. But we thought it was really important to catch up with people before Christmas. And of course, there have been a number of significant outcomes that have happened this week. So we wanted to catch up with as many of our members as we possibly could to give you all of the information that we have, but of course, give you the opportunity as well to put other questions on the table that might not be answered by the department as yet. So if you can please use the Q&A function if you've got questions rather than the chat function. It just makes it easier for us to capture those and make sure that we are answering as many as we possibly can. As always, if you have questions that either we don't get to today or haven't been answered through this presentation, please email us at your.union@together.org.au. Everybody would probably have either myself or Billy's contact details as well, so please feel free to contact us directly as well. So obviously today we are here to talk about vaccination in CYJMA and the updates that have occurred this week. Before we talk about the specifics of what has happened this week, just wanted to take a very quick moment to run through some of the overarching results from our member survey that we conducted last week and this week. So thank you to the hundreds of members who did participate in that survey. It's really important to hear what you're thinking at the moment. So we asked members if they supported a consistent approach to COVID-19 related matters across public sector agencies, and a pretty significant majority of members said they would like to see consistency. And a very significant majority of our members as well supported a campaign for respectful workplaces and mental health support in regards to COVID-19 issues, as well as regular consultation meetings with Together members, delegates and management as well. We did also ask our members in terms of whether or not they support vaccination being made mandatory for CYJMA employees. So a majority of members did support that. Of course, there are 27% of our members who said no, and then about 12% of our members who said they were unsure when we asked them that question at that point. So we'll come back to talking about these issues more broadly after we talk about the specifics of what's occurred this week. But I just wanted to give you those headline figures first up as well. So this has been a very significant week when it comes to the vaccination mandate in CYJMA. So the two most significant announcements, and they are interconnected of course as well, were on Saturday, the Chief Health Officer issued the direction COVID-19 vaccination requirements for workers in a high-risk setting direction. So this is the lawful direction that underpins the subsequent release of the departmental policy mandatory COVID-19 vaccination. So those two things, they work together, and the CHO direction is the reason that the departmental policy has been released as well. I should say at this point as well, we do, and we have already raised with the department, we really do think that the communications that have been sent out from the Director General and potentially some conflicting advice as well that you're receiving from your regional management, we're very concerned that there is a lot of confusion based on the release of this departmental policy. So what we'd like to do today is to try to unpack that as much as possible There may be some questions that we can't answer today. There are still things that are not yet decided, so we can't give definitive answers, but we do want to use this opportunity to clear up some of the, quite frankly, nonsense that we've heard from members and delegates across the state about what this means, particularly for our members who are not based in youth detention centres. So thank you as well for all of the members and delegates who have been contacting us saying, I've heard this from my manager or I've heard this from my regional director, because that is important for us to hear as well. And we're very happy to escalate those issues where it doesn't match with the information that we've been hearing from the department. So to take it back to, I guess, the foundation of what's happening in the department, which is the CHO direction, we just wanted to have a look at what the direction actually says about both high-risk settings and how they define a worker in terms of workers that must be vaccinated in relation to high-risk settings. So the high-risk settings under this direction are early childhood, primary and secondary education settings, which also includes outside of school hour care and daycare, corrective services facilities, police watch houses, youth detention centres and airports. The way the worker has been defined in this direction, and we've highlighted the specific definitions that we think are most relevant to our discussions today. So the way that a worker is defined is a person who is employed at a high-risk setting on a part-time, casual or full-time basis, is a government employee whose duties involve attendance at a high-risk setting, someone who undertakes work, whether paid or unpaid, at the high-risk setting, is attending the high-risk setting in the context of duties relating to the administration, regulation, governance, managerial oversight or legal framework relating to the high-risk setting, or is a performer, presenter or other specialist entering the high-risk setting as part of delivering an activity, function or event. So what does this mean for our members in CYJMA? And as a little bit like we discussed last time in our last Zoom briefing, it is a bit confusing and frustrating because there's certainly quite a few levels of difference based on where you work and the sort of work that you do. So we'll try to be as clear as we possibly can, but I also do, if there is some confusion about this, please obviously throw it in the Q&A or feel free to contact us afterwards, because we may not be able to get down right to the tin tacks of what it means for each individual who is on this Zoom, but hopefully we can provide you with some overarching advice about what exactly that means. So if you are a CYJMA employee who works in a high-risk setting, and I think there's probably, even within workers who work in a high-risk setting, there's probably two sort of distinct groups there. So if you are, for instance, if you're a detention youth worker, if you are based at a youth detention centre, it is pretty clear cut for you that you'll need to be fully vaccinated by the 23rd of January in order to continue working in your role. So technically, staff would be required to have one dose of a vaccine by today. So today is a very key date in terms of this direction, the 17th of December. But there is a provision in the direction that allows for a 1 month grace period, essentially. And that's in order to keep the service running. So the department is utilising that provision. And what that means is that even if you are, for instance, a detention youth worker, or if you are a manager at a youth detention centre or a section supervisor, you work in BYDC or Westmoreland or Cleveland, and you're unvaccinated, you are still able to enter the worksite, the high-risk setting, until the 23rd of January. There are some additional things that you need to undertake in order to do that, though, and primarily they are taking a PCR test. So that is the test that's conducted by pathology or through another healthcare setting. It's not one of those new rapid tests. It is a PCR test that needs to be processed through pathology. And you also need to wear PPE if you're accessing the high-risk setting between now and the 23rd of January. If you're unvaccinated, I should say, sorry. If visiting a high-risk setting is a really inherent and regular part of your role, So even if you aren't employed by youth detention, but for instance, you might be one of the CSOs who regularly visits youth detention centres, you might be another youth justice staff member who you might be based in 111 George, but you're visiting a youth detention centre on a weekly basis, and that's an inherent part of your role, you are most likely covered by this direction as well. So those are the two that are, and one is certainly more clear-cut than the other, but those are the sort of two groups that I would say when you can say, you know, hand on heart, I do work in a high-risk setting. Now, and this is where I think we understandably have had our most questions from members, which is the Group A in Schedule 1 of the policy. And once again, we certainly have identified to the department that we have found this very confusing, and we entirely understand the questions that we're getting from our members who similarly find this confusing and don't quite understand what it means for them, particularly come Monday, which we'll talk about. So the roles in Group A are positions that have been identified by the department as those that may be required to attend high-risk settings as a regular part of your role. So I think it's important at this point as well to note that it's not just youth detention centres. Obviously, they are the only high-risk setting that's owned by this department, but it's also schools, correctional facilities, airports, watch houses too. So that's important to keep in mind when we're thinking about this group. So the department, and as if you're, you know, an eagle-eyed viewer of the policy, you probably would have seen as well that they have been very clear to say these roles may be part of this group. So if it is the case that, you know, you are let's say a CSO at Anala, for instance, and you are regularly visiting BYDC, if that is an inherent part of your role too, and you know, you must be able to attend these high-risk settings in order to complete your role and to complete your duties, it's probably likely that the CHO direction will capture your role as well. But really important for us to know, particularly given that today is a key date, the 17th of December, it's really important to know, unlike we've heard, unfortunately, from some service centres, that doesn't mean that you can't show up to work on Monday, by no means. Unfortunately, we have heard that reported back to us from a couple of service centres across the state. So we're hopeful, we've obviously raised that with the department, so we're really hopeful that some clarifying information will go out ASAP, because we certainly don't want people at work today to be thinking, what happens to me on Monday? I've been told that I can't attend the workplace, because that's not true. And it also means, our understanding, and what we will be pursuing, is that it doesn't mean that even if your role as a CSO, youth worker, whichever category that you might be under Group A, even if it is an inherent part of your role, that should not mean that you are issued a notice to show cause today if you are unvaccinated. So what happens if I'm unvaccinated, my role is in Group A, even if I don't necessarily believe that my role should be in Group A? What does that mean for me come Monday, after today, the 17th, being a really important day? So for the period between today and the 23rd of January, and this is tied, of course, to that almost 1 month grace period that the department has utilised for the purposes of youth detention centres. So if you are in that Group A setting, and if you believe that, yes, it is, fair enough that you do visit schools, youth detention centres, watch houses, etc., even if you're unvaccinated, as of Monday, there shouldn't be any change to your day-to-day work. So what should happen is that discussions should continue at a workplace level, and we will certainly continue having discussions with the department at an agency-wide level about what roles fall under the CHO direction, and what that means for those roles. I think it's also important to note at this point, as you have probably seen if you are either looking through the policy, or if you have looked through the PowerPoint, or if it's been shown in your workplace, that there is also the potential for further discussion about employer-mandated vaccination requirements. So we'll talk a little bit about that later, but we just thought important to note as well that that's probably a conversation that we'll be continuing next week and into the new year in your workplace as well. If you are an employee who falls into the Group A and it is a natural part of your role that you're attending youth detention centres, schools, etc., up to the 23rd of January, if you are required to attend a high-risk setting and you're unvaccinated, you will still be able to do that, provided that you do abide by that high-risk settings requirements. So what we know for youth detention centres, again, is that that will be a PCR test and wearing PPE too. So we have also had some, as you probably would have seen from the email that we sent out to members on Wednesday as well. So there is that Group A that's been listed in the policy. We want to hear from members about whether or not, if you are, for instance, a CSSO, if you're a youth worker or a caseworker, if you've been listed in Group A, but you're thinking, I can't remember the last time I went to a school. I've never been to the youth detention centre. I've never been required to attend a workplace. I should also say as well, hospitals are of course included in this under a different direction, but hospitals will also require visitors to be vaccinated. So if you're thinking, I don't go to hospitals, I don't go to schools, I don't go to youth detention centres, but I'm listed in Group A, we want to hear from you. You know, we want that information because it will be different, potentially depending on service centre to service centre, region to region. So we really need members to be coming to us as well saying, I'm Group A, this is where I work, I don't go to high-risk setting. And in those circumstances, with that information, we'll be advocating to the department to say, we really don't think that the CHO direction applies here. We think this is overreach. So the department centrally has indicated that they do want to be flexible around this. I also know that myself and Billy and some of our other regional colleagues have been hearing that that's not the message that all service centres or regions are putting out there. So if you are having conversations where you're feeling that it is extremely punitive or that there is no flexibility, that your manager or regional management are just saying, oh, well, you know, CSO, that's listed in Group A, so got to be vaccinated, whereas you're a CSO who has never had to go to any of these high-risk settings, please let us know, because that shouldn't be the discussions that are happening. Unfortunately, we know that there are some of those discussions happening, and we have raised those where we've been given that advice. So please don't hesitate to reach out to us about that. We already know that this is, you know, it has the potential to be quite a charged discussion anyway. So we want to make sure that we are de-escalating this as much as possible, and that these discussions are happening in a supportive, consultative and respectful way. So in terms of exemptions for staff who do attend high-risk settings, because this is falling out of a CHO direction, the ability for exemptions to be sought is very narrow. Essentially, the only exemptions that we understand will be provided are based on the ATAGI advice about medical contraindications, which are very narrow. So we can certainly, I think we may have already provided that information, but if not, if you've got questions about that, we can point you in the right direction. Of course, if you do believe that, you know, you may have a medical issue that prevents you from accessing the vaccinations available, your general practitioner or your specialist medical practitioners, they're the best people to talk to in those instances. But we will, of course, be supporting any members who do have those medical exemptions through what that process might look like. We still need to have some further discussions with the department about what exactly that looks like. So if you've got any questions, please do let us know. So if it is the case that your role is required to visit high-risk settings, it's an inherent part of your role, so you would be caught up with the CHO direction, but you're not willing to get vaccinated. So where does that leave employees who might fall into this category? So what we understand, and if you were looking at the policy, you probably would have seen the dates, of course, of the 17th December being a very key one, where staff who are indicating that they're unwilling to get vaccinated but are covered by the CHO direction would be issued a notice to show cause. Our understanding is that this is very much only for staff who are essentially working in youth detention centres, where there is no doubt that this policy and this direction applies to them. And we know that, that unfortunately there may have been some managers or regional management out there saying that this is the case. We understand that this is not the case. So if you're hearing differently, if you have anybody, seeking to go down this path, if you were in this situation, please let us know ASAP. So what we have seen in other agencies who are a bit more progressed with this process, both in relation to employer mandates, but also those in relation to CHO directions. What the process generally is that staff will be issued a notice to show cause, and they will be asked to show cause as to why they shouldn't be suspended without pay. And so what CYJMA has currently indicated to us is that there will be a 21-day response period for staff who receive that show cause notice. I think important to note at this point that Together centrally is very concerned about the relatively swift move to suspension without pay as part of the notice to show cause process. So centrally, we are working to challenge that. We believe that it does lower the threshold to suspend someone without pay quite significantly. So we will keep members updated as we progress through that process as well. On an individual level, if any of our members do find themselves in these circumstances, we will obviously support you through that process. So if you are having any of those conversations, if you're getting any sort of directions along these lines, please, as soon as possible, give us a call, shoot us an email so we can support you through that process and give you the best possible advice based on your individual circumstances as well. Unfortunately, in relation to this disciplinary process that is arising from vaccination mandates, we are seeing that the penalty that people are being asked to respond to is dismissal. So we are, of course, working with our members through those processes, and we will support you through that. I think it will be interesting here in CYJMA, where for those areas that are a little bit grey, the department is certainly suggesting that there should be some flexibility around that. So, of course, we'll be supporting members through that and continuing to update you as we have more information that comes to hand. I think generally our advice is, if you're ever in a circumstance like that, or you think you might be in a circumstance like that, please get in touch with the union office ASAP so we can provide you with that information and that support. So, in addition, and this is probably a little bit clearer to members who might have looked at the PowerPoint presentation or had the PowerPoint presentation played for them. So in addition to what is occurring through the CHO direction, the department has also flagged that they are considering an employer mandate for other roles that are not captured by the CHO direction. We don't know how broad they would be seeking to go with that as yet. There hasn't been a proposal put on the table together. If you recall back to, it's probably maybe even 5 weeks ago now, we had a meeting with the Director General where she had initially flagged that she was considering an employer mandate for certain parts of the department. Obviously, the CHO direction overtook that a little bit, but that still seems to be where the department are thinking they will land. So generally speaking, employer mandates have been upheld as lawful and reasonable within limits. Some of you may be aware of the BHP decision that I think was delivered about a fortnight ago, where the issue there was lack of consultation. So it wasn't necessarily that BHP's decision to implement an employer mandate around vaccination itself was unreasonable, but the way in which they went about it was. So we hope to have more information forthcoming in relation to this policy too and what it might mean for other parts of the department. But please do rest assured that consultation needs to occur when that happens. And that's through obviously union channels, but also through workplace health and safety channels. So if you're a workplace health and safety rep, please, keep an ear out, because they certainly should be coming and speaking to your committees about what that might look like. So as soon as we have more information about that, and I don't expect that that will be this year, given that we only have a week left in the year. I expect that that will most likely be at some point in January. We'll have some more information regarding what that process looks like as well. But please be assured that as soon as we do have that information, we'll be sharing that with members. So returning a little bit to some of the member feedback that we discussed at the start of this presentation. So vaccination mandates are one part of controlling the impact of COVID in the workplace, but it's certainly not the only thing. So we know that if even in workplaces where vaccination is mandated, it's very likely that there will still be outbreaks of COVID. With the borders having opened 4 days ago, certainly we are seeing that there is COVID in the community. This is a different situation for Queensland, mostly since the last 18 months. So the conversation about that is obviously evolving, but we do want to acknowledge, of course, as a union, that vaccination is not the only question, nor the only discussion that ought to be happening at the workplace level. So across the Queensland Public Service, as a bit of background for what we're liking to talk about as the roadmap for the public service response for COVID. And I am conscious that we're just hitting the half-hour mark here, sorry, so I'll probably move through this a little bit quickly. About a month ago, our branch conference met to talk about the public service response for COVID and endorse some principles about how we want to engage with agencies. And certainly a significant part of that is, of course, having consultation with workers, using a really strong evidence base, and having respectful conversations about what can be quite a challenging point of discussion as well. Because we certainly think that the alternative to having a plan, to having a roadmap, is that we will see poor decisions made by departments. There could be rushed consultation with no opportunity for union members to have their voice heard, and we don't want to see individual rights compromised regardless of what this might look like. So we are talking to departments about what we like to call the traffic lights process as well. So that includes making evidence-based decisions, including looking at things like existing vaccination rates amongst staff. As we've previously advised our members in CYJMA, when the Director General has sought to ask the vaccination status of employees, we do think that is a reasonable management action there. We would also expect that agencies make decisions specifically for their agencies, however, developed around centrally developed options. So there is some consistency across the public service. And a really key part of that is having respectful conversations and having respectful workplaces. So these are some of the decisions that we would expect government as an employer to make around that. So consistent approaches, what we're terming as a ripple effect from CHO mandates. So that's a little bit of what we are dealing with in CYJMA at the moment, but seeking a consistent approach to this. And as we said, having a really key part of that being support for respectful workplaces and mental health support as well. And then flowing on from that, these are the sorts of things that we would expect from each agency individually. We should note as well, I think it was maybe last week, potentially the week before, as I'm sure you all know, December is going very quickly. We had another meeting with the Director General and Minister Linnard, where we essentially put the principles of everything that we have on this slide to the Director General. She was very supportive of that. So we expect that there will be some further discussion about what exactly that looks like and some specific timeframes around that. We're very conscious, as I think the department is to some level, that we are almost up to Christmas time. It is school holidays. It's not a great time to have really significant consultation processes. So we would like to see that happening more in the new year and not now. And we understand that that is probably likely based on what we've heard from the department thus far. So while, of course, here in CYJMA and in departments like education, who are also subject to the CHO mandate, and also corrections, there is a really big focus on the vaccination mandate and handling the implementation of that. We know that it's not the only part of COVID in workplaces that we need to have those discussions with your employer about. So keep an eye out as well for some further campaign materials from us under our Safer Together banner, because we do really want to ensure that members have their voices heard, that we're having really respectful conversations in the workplace, acknowledging that this has been a really tough 2 years, and 2022 will be a very different kind of difficult, I think, flowing on from COVID, that it has been really difficult and some people's mental health has really suffered because of that. And ensuring that, you know, your voices as employees on the ground is very central to all of that process. So that's what we wanted to cover today. We have been recording this session too. So if you have any colleagues who said they wanted to make it but couldn't, we will send out a link to a recording of this session. Thank you so much, everyone, for being part of these discussions, particularly at a very dreadful time for us to have these discussions. So we really appreciate your time today. Please continue raising your questions and concerns with us, either through myself or Billy, or through your.union@together.org.au. And we will, of course, be in touch with members as we hear more information, but please don't hesitate to get in touch with us if you've got questions or concerns. We are here to help through that process. So we might leave it there for today. So just once again, thank you everyone for your time. And if we don't speak beforehand, wishing you all, you and your loved ones, a very Merry Christmas and a Happy New Year. And we'll continue working with you all in 2022. So thank you everyone, take care, and we'll be in touch soon.